Now, if cancer is suspected in a patient, surgeons will most likely have to remove some of the suspected tissue and test it. Getting the results could be a long process. A new invention called a Masspec pen could cut the wait time to just seconds. VOA's Elizabeth Lee reports from Austin, Texas, where the pen was created.
One touch of this pen can detect cancer almost immediately.
Well, it's a game changer because I was doing a case the other day with a surgeon and we had to wait an additional 2 hours because the current method takes that long.
Aiden Zahadivash is a medical student and co-creator of the Masspec pen. He says the pen can deliver cancer results within 20 seconds and is much less invasive for the patient than the traditional method of confirming the disease.
That process usually will involve taking out some of the tissue, which means cutting it from a patient. Our technology can detect cancer inside of a tissue without cutting it or altering it.
A drop of water on the pen pulls molecules from the suspected cancerous tissue during surgery. This instrument, called a mass spectrometer, then analyzes the water to determine whether cancer is present. It adds precision to detecting cancer. In seconds, surgeons will know what part of the tissue to excise, how much to cut, and what not to cut, so healthy tissue isn't damaged.
We've done testing on human tissues that have been taken out of patients, and those have shown 96% accuracy detecting cancer from not cancer.
Newly available technologies have allowed an interdisciplinary team to develop this pen in 2.5 years.
We've 3D printed all the prototyping, which allowed us to rapidly develop a design that worked.
Zahadivash says within the year, the Masspec pen will be tested in surgery at the Dell Medical School at the University of Texas at Austin. There are also plans to test this technology at MD Anderson Cancer Center and Baylor College of Medicine in Houston, Texas. Elizabeth Lee, VOA News, Austin.